Hi guys, welcome back to the channel. I'm here again today with Dr. Kishan. We have got something very exciting to let you all know about. As you know, we have been looking at doing hormones for our patients for some time, and we finally decided to go ahead and do it. Dr. Kish is going to be available for this going forwards, which I'm very excited about.
Yeah, I think we've approached sort of aesthetics for a long time where we've been addressing the outer appearance and making people look good, and obviously that has an internal effect as well. You feel good as well. However, this is taking things one step further and addressing internal health and internal well-being, which I think is really key even to aesthetics. So that's certainly one of the outer signs of hormonally balanced health that we see.
So for our first video, we are going to be talking all about men, you lucky guys. So why don't you run us through what is it that you're doing? So what testing are you doing and what are you prescribing?
Sure. So ideally we want to have a consultation with our patients first, either face-to-face or we can do it over a Skype consultation. We have a at-home testing service as well, which includes a blood sample test and a urine sample test as well. So that's actually gives us a much more comprehensive picture of where you would be at the start of any hormonal treatment.
You guys at home are probably all familiar with this term andropause. Why don't you maybe expand a little bit on that?
Well, it's called andropause, MANopause. You can call it, essentially it's a functional testosterone deficit.
Yeah. Sorry, I'm just falling over.
Your testosterone levels tend to fall over as we get older and older and older. Realistically, it's so gradual that people don't notice symptoms as you might do as a menopausal female. But if you're a man in his 40s or 50s or 60s going through this particular time, you may start to feel symptoms of this functional testosterone deficit, and these include things like lack of energy, lack of libido, poor skin health. Osteoporosis can also occur as well. So osteoporosis is basically weakening of the mineral content of the bones, and that leaves us with more brittle bones as well.
I've heard people describe it as grumpy old men syndrome.
Exactly. I mean, so this is the thing. So mood is greatly affected by hormonal imbalance. Now that can occur at any age, and that really depends what we're putting into our bodies in terms of our diet, stresses we face, and also where we're living, like what sort of toxic elements we're exposed to as well. These all have an impact on hormonal balance. Testosterone is the key hormone for men. There are others, including thyroid and growth hormone and cortisol as well. However, testosterone seems to tick a lot of boxes when it comes to starting that journey in hormonal balance. And I suppose that's what I look at first, as well as sort of a comprehensive look at your hormones in general. It's been known for a long time that a few conditions are related to low testosterone. So cardiovascular ill health, cardiovascular disease, as well as prostate disease are all linked to low testosterone levels. Actually, I think supplementing to a healthy, balanced level confers some protection against cardiovascular and prostate disease.
Okay, so assuming that we're going to be doing some supplementation, you've done all the testing beforehand, I get a lot of patients asking me whether we do injections.
Okay.
So
we're doing injections in the face all the time, and I think that it's a convenient option for lots of patients, and certainly in America it's probably, and here to a certain extent, it's a very popular treatment. However, the research shows that with injections one gets a serum spike in testosterone levels. So that means for the first 2 weeks of a normal testosterone replacement, like testosterone ethanoate, you will feel improved, you'll feel much more hormonally balanced, but then in the following weeks that feeling declines and you end up feeling more and more like you were previous to the testosterone replacement injection. So for that reason, I tend to use transdermal cream. Now the advantage of transdermal cream is that it's much more physiological, it gives a much more steady state of testosterone, and that for me is a much more reliable option for my patients.
What would you say to patients who are worried about maybe the testosterone converting to DHT?
So the whole reason we ask our patients to do a comprehensive hormonal assessment, blood and on a urine analysis, is that it actually gives us the complete picture of what happens to testosterone, how active your 5-alpha reductase enzyme is, because that's also got a key role in producing dihydrotestosterone. Now this is a hormonal component that's actually active in the skin and the hair. So this will give you thinning of the hair, and also it can predispose you to acne and more oily skin as well. So it's about getting that hormonal balance correct. And just because you have excess 5-alpha reductase activity, it doesn't mean that testosterone replacement isn't an option for you. It just means that we have to tailor-make the treatment for you.
And what about the use of finasteride or saw palmetto?
So exactly, so making this like almost precision medicine for you, or tailor-made to you, is we would use things like saw palmetto, finasteride, even dutasteride, either in a compounded topical format or maybe a very, very low dose, the minimal dose that you need to prevent excessive conversion of testosterone to dihydrotestosterone.
Can you maybe speak to what's going on in the States regarding the finasteride?
You mean the post-finasteride syndrome? So what I've heard is that there are increased cases of people reporting long-term complications of being on oral finasteride. So these include persistent erectile dysfunction, mood disorder, amongst other things. And the thing is, we don't seem to see that here. Nevertheless, I think we've got a safer, a topical version that perhaps doesn't have as much systemic absorption. I think I would prefer to use that and that's what I tend to do.
What about maybe somebody having an injection to increase their testosterone and then converting over to the cream? I've heard some people talking about this. Is that something you practice?
So that's a strategy, but that's not something I do. Again, it's almost about rushing to get to that point. I mean, that's fine for some practitioners and fine for some patients, but the way I prefer to practice is a much more reliable, steady state of achieving hormonal balance. I just find that there's a lot more control in using a transdermal cream. The other advantage is that I can dial it up or dial it down as necessary. So literally, if you start to develop some symptoms that you don't want, it's very, very easy to dial that dosage down. Whereas with an injection or a pellet therapy, which is really popular in the States, and I believe some practitioners use it here as well, there's a degree of, how do I say this, inflexibility in how you change the dosage for your patient.
Where are they applying this cream?
So you can apply it to the inner arms or the inner wrist. You can apply it to the hairless skin of the neck. You can also apply a little bit to the forehead. It's also got anti-wrinkle activity as well. A lot of gentlemen put it on the abdomen or the sides of the abdomen and on the inner part of the groin.
What if somebody is younger?
So the major major consideration, I suppose, of testosterone replacement is that it prevents development of sperm. So testosterone replacement isn't an option for a male who wishes to have children. So there are other options, and there are medications that we would discuss with you if that would be something you'd want to do. However, testosterone replacement, I prefer to treat patients who are in their 40s or 50s who are beyond their years of fertility or beyond their years where they want to have children.
So can you maybe explain to the guys at home a little bit about what we're doing, which is different?
Well, I think what we're going to try to provide is a much more tailor-made approach. So the future really is precision medicine. Yes, it does mean initially a lot more testing and testing further down the line, particularly as things change, but that ultimately gives you your unique prescription, your unique treatment plan for achieving proper hormonal balance.
Okay guys, so that's it for this week. Please join us again next week where we'll be talking about hair loss. Are we going to be talking about men and women?
Oh yeah.
Okay, I'll see you then.